Hi, I'm glad you're here today. We're going to talk about Today we're going to talk about Socratic questioning and guided discovery. This is one of the most powerful things we do in therapy. It's often where change begins. It's not when we give advice, it's not when we explain things, but it's when we ask the right kind of question and pause long enough for the insight to happen. Sometimes it takes much longer than an ordinary conversation. So today, I'm going to break this down. We'll look at what Socratic questioning really is and what it isn't, how guided discovery works in real sessions. We'll talk about the four types of questions you can start using right away, the role of cognitive dissonance, as defined in psychology, and how this shows up most often in anxiety and depression. So let's start with the basics. What is Socratic questioning? And you might have heard the term used before, maybe in school or maybe as a technique used in a debate. But in therapy, Socratic questioning is slightly different. It's not about trapping somebody with logic or firing off why questions like a spotlight in an interrogation room. We certainly don't want our clients to feel interrogated or trapped intellectually. Socratic questioning is a gentle, curious process that helps the client hear themselves, sometimes for the first time in a meaningful way. So let's walk through three core principles. First, what we call collaborative empiricism. This term comes from Aaron Beck, who was the founder of CBT. It means that we're not teaching the client what to believe. We will explore their beliefs with them. We're saying, let's look at this thought together. Let's see where it came from. And let's decide whether it is helpful or not. Imagine two people shining flashlights in the same cave. The client brings the story, and we help examine it from different angles. Second, very important, is curiosity. Now, it has to be real, genuine curiosity. That's essential. We're not leading them anywhere. We're not trying to be clever. We have to be genuinely interested. Such questions like, how did you arrive at that belief? What makes that thought feel true? The tone matters, timing matters, and curiosity itself can open a door. If you do it with the wrong tone, the door closes real fast. Number three, structured inquiry. This kind of questioning has direction. It's not random, and it moves through layers. You might start by clarifying to breadth. Then you explore the evidence, going in a little more depth. And then look at alternative perspectives. Finally, you would consider, or you actually offer to the client to consider the consequences of holding that belief. One way you can think of it is like building a staircase with each question another step, and ideally, the client is going to walk up those stairs by himself. Now, don't you think you have to have the perfect question? You never necessarily have the perfect question. But with more practice with this, it becomes easier and easier to guide those deeper moments of insight, and that's really your goal. Now let's look at guided discovery. Let's zoom out a little. Guided discovery is the larger process we're using when we apply Socratic questioning. It's how we help clients connect the dots that they hadn't connected before. They have all the dots, they have all the data in their brain, but it doesn't come together and coalesce as a complete picture. Again, it's not about advice and it's not about interpretation. The whole point here is to invite them to think differently and on their own terms. So here's a quick example. A client says, if I make one mistake at work, everyone will think I'm incompetent. That's not an unusual type of thing to hear. It might actually point to perfectionism, but we're not even going to go there yet. We might gently ask, has that actually happened? That you've made a mistake at work and everybody thought you were incompetent? You might follow it up with, is it one mistake enough? And is it really everyone? And I'm just wondering how you actually know what they're thinking. Or you might ask, are there people who you expect to make mistakes? Or I'm wondering, what percentage of people do you know that don't make any mistakes? Or you might ask, what does it mean to be competent really? So you're not correcting them, you're walking with them towards a more flexible perspective. And when they come to an insight on their own, then their thinking begins to shift. Honestly, it's one of the best parts of this work. You actually can see and feel the transformation of a person's perspective. And right up there with finishing your notes on time, so to speak, that would also be a good thing. But okay, not quite that satisfying, but close. I'd like to break this down to 4 types of questions that you'll use again and again and again. Let's break it down to questions that tend to work well. There are 4 categories you want to have in your toolkit. Important tools. The first one are basically clarification questions where you start with trying to understand. I don't know about you, but I almost always need clarifications. It's hard for me to understand sometimes. But when you ask the questions, it helps both you and the client get a clearer way of what they're actually thinking. So try something on that same case we talked about. When you say I failed, what does that mean to you? Or what did it look like at that moment that you failed or thought you failed? Or something, I don't quite understand what you mean by lazy in this situation. Can you help me understand that? In other words, we often hear big loaded labels that, hey, this is what everybody understands, but it's not. Clarifying them helps them unpack what the real meaning is. A second category of questions, which is evidence-seeking questions. This is especially important in CBT. You'd be asking, like, is this belief based on fact, based on fear? Is it rational? Is it irrational? So, for instance, you might ask, what evidence supports that? Or is there any evidence that refutes it? Have you ever seen something like the opposite happen? The clients with anxiety especially tend to believe that their thoughts are facts. In other words, they're projecting into the future something negative, and they believe it's absolutely going to happen. So these types of questions gently disrupt that pattern. Well, of course, sometimes they're going to say, I just know it, which is fine. It just means we have to go on peeling the onion. And even though you're peeling the onion with little luck, there'll be less crying at the end. A third category, alternative viewpoint questions. These help to loosen the grip on the black and white thinking, which is often a problem, or all or nothing thinking. So one can ask, how might someone else see this? Or if your best friend said this about themselves, what would you say to them? Or a little bit stronger, if we had a clone of you and you are talking to that person who absolutely knows everything about you because she's actually a clone of you, and she says to you and then you repeat back what they said to them, what would you say to them? Or just simply, could there be another explanation for what happened? And not about convincing. You're not trying to convince her of anything. You're just expanding the view. And then there's a fourth type. And these are consequence analysis questions. These questions are about the impact. You sort of like invite the client to look at the emotional cost of a particular belief. And you also try to look at the emotional benefits of this particular belief. So the belief that you have to do everything perfectly, what does that cost you? How is that not to your benefit? She might say that it puts me under constant pressure. I do better. I look at myself. I have better self-criticism. Come up with a dozen different things. But you'd also want to ask, what's the cost? The cost and the benefit. I get more anxious. I constantly failing because you make one mistake, you're a constant failure. I'm worried about what people think of me, etc. You can also ask, how does it affect your relationships? Again, positive and negative. And then you might ask something like, if there was a shift in this, if you didn't actually have to be perfect, how, if you loosened your belief in that, how would that affect you? And you're not pushing them to change, no rush, but you're trying to let them feel the weight of the belief and to imagine life without it so they can look forward to not having that weight on their shoulders. I'd like to talk a few minutes also about insight and cognitive dissonance. So let's talk briefly about cognitive dissonance. And I've heard a lot of people say, oh, this is the cognitive dissonance in me, when they don't really know what the psychological meaning is. So I just want to make sure that's clear. It's a moment of internal tension when the client realizes that two beliefs that they hold don't actually match. In other words, there's two things that they believe and they can't bring them together. And that's the tension. And sometimes that's where growth begins. So for instance, the client says, I'm just such a bad friend. But if they were going to say, through the questioning, I did help my friend move last week. Those are two different beliefs. And that's the dissonance. And if you pick up on that, you might ask something like, how do those two pieces fit together? Could they both be true? And now they're in a space where they have to reconcile that discomfort. And from there, the belief system might start to shift. Again, the key is do not rush to reassure. Sure, you're a good friend. Look what you did. Because then they can go into the say that doesn't mean anything. They'll defend their unhealthy beliefs. Don't rush it. Let the discomfort sit there and breathe until they figure out how to reconcile it. And if they don't, then we go a little further. So let's apply this with anxiety and depression, in a practical sense. You're going to see a lot of anxiety and depression in your practice, in your career. So Socratic questioning is incredibly effective for anxiety and depression, particularly known for its application in CBT, but also in other formats and other methodologies and other schools. So let's talk about anxiety first. So client will often predict the worst case scenario and then treat it like a fact. So client's going in trying to get a job, and he says, if I mess up this interview, I'll never get hired again. So you might ask, messing up, what would messing up look like? What does it mean to you? Or you might ask also, has it actually happened before that you messed up and then afterwards you never get hired? And you might also ask something like, is it possible for someone to stumble and still make a good impression? So you're not talking them out of their fear. You're just helping them to test it. Let's talk about for depression. Depressed clients will often think in extremes. I'm worthless. And nothing I do matters. So you might say, can you think of one small thing you did recently that helped someone? Or you might say, or do even a role play. Let's say I'm your friend and I come and talk to you. And I say to you, I'm worthless because I didn't complete that job. Doesn't that make me worthless? And ask the client, if I was your friend coming and saying that to you, how would you tell me? What would you tell me? And you might say also something like, is it possible the way you feel right now is coloring how you see yourself? In other words, is your emotions coming up and making you feel that it's true? So again, you're not giving false hope. You're just giving contrast, letting more than one truth come into the forum. All right, let's land this. Now, these skills take a lot of time. You're not going to master them in a week, and that's okay. But I absolutely encourage you to practice. Focus on tone, not perfection. Stay genuinely curious about what's going on for your client. Let silence do some of the work. I'd even say silence actually is where the real work gets done. Your questioning is just a catalyst for what can go on during the silent time. And trust that even one good question asked at the right time can shift everything. That doesn't mean you ask one question, but amongst those questions you ask, you're going to hit the nail on the head. And does it happen in one session? No, even if your client doesn't walk away with a complete cognitive reframe, if you help them to shift a little bit in one belief, that's still real movement. And hey, if they get stuck, remember, even realizing you're stuck is a step forward. So anyway, thanks for sticking with this. Take a moment to reflect and think. And maybe what's one question you've asked in the past week that helped open something up? And what's one that you might actually ask different now? Thanks.